So, Ram, one of the things I was going to ask you about is you're a technologist first, and then, like a good Indian son, the parents said do medicine, and you did medicine. So, and I guess your original interest always came back. So we all know your story of how you came back to India and set yourself up here. Just tell us a little bit about, you could have been a surgeon here. You could have continued what you were doing as a cardiothoracic surgeon. And we had an interesting conversation about how you could have influenced maybe 10,000 patients, 20,000 patients. But if you do something with technology, you can probably influence millions of people. So tell me a little bit about that shift and how can you use technology to solve a fundamental problem? So according to you, what is the fundamental problem we are trying to solve?
Yeah, it's a great question. So first off, I want to thank you and Nene and Vaibhavi and everyone else. I'm back home with family again. I've probably been with you guys, 10 years? And when you asked me in LA, I said, for sure, I'll be there. But congratulations after a very difficult time during the pandemic and bringing everyone together. And half of these people in the room I already knew, and the next half I'm learning their names. So I welcome talking to all of you. Back to your question. You stated it well that I had a software company when I was 14, and my Maharashtrian parents said, you either become a doctor or engineer or we won't pay for it. And in their algorithm as first-generation immigrants, they didn't know anything better. But I dutifully then did not go to Stanford, did not go to Berkeley, where I got in everywhere, and went to an undergrad med program at WashU. Finished there, went to UCLA, did general and vascular surgery, then did heart surgery at University of Florida, then practiced. What I found time and again is I could come in the nick of time with millimeters and milliseconds and save lives. And it was very rewarding because you would see patients on death's door come back. And it was a team effort. 80 of us, like a very large cricket team or football team coming together to do something which mattered. The problem was that when you looked at what I did, at most I could operate on 3 to 5 patients in a day, maybe see another 2,000 consults in the year, and at the end of it, maybe 500 patients a year. When you look at the world now, it's 8 billion people. When I came to India in 2011, it was 7 billion. But I made a choice in 2011, and I was the managing director of a hospital, a partner in a group, and when I told them that I was leaving to go do startups in India to democratize healthcare by using media, tech, and smart services, they all looked at me like I was crazy. My middle-class Maharashtrian parents were like, what are you doing? You're every Indian's dream, and now you're walking away from it to uncertainty. Fortunately, it all worked. And the idea is simple, that if you can change things, and as I see it, the gap problems are lack of awareness and lack of access to world-class, evidence-based medicine for everyone. So the question is, how are we going to democratize healthcare? And I think over the last 10 years, I've learned a lot. I've done a few things, and really had a lot of fun at what I did, and met some people who are inspirational. You're one of them. There's so many in the room who kind of changed me back to who I originally was. Someone who was fearless and not stopped by titles or monikers of what I should be doing. Now back to health in India. When I looked at the India lens, there's 1.412 billion patients. Only about a million doctors. So the ratio is small. When you look at beds, depending on where you're looking, if you're in South Bombay, the bed ratio comes close. But India's not one India. It's 28 states and 8 union territories comprising 30% metro, 70% rural. And the problem is only 2% of those MBBSs ever make it to the rural areas. And there are a lot of people who are underserved. As a result, due to that and other factors, we have a life expectancy in India which is 10 years less than the rest of the planet, which is heartbreaking to me. Some of that might be from maternal fetal mortality, some of that may be from other things, but it was estimated by 2023 that most people would die of non-communicable diseases. Along came COVID and it changed that reality, but at some point, we're a young population. Over 2/3 of our people are less than 35. Our median life or median age is 28. If we don't prepare now for the future by raising awareness and improving access, we're going to be faced with a situation where later we're not going to be able to take care of people.
Yeah.
And so I think that's where we came into what we're doing now by creating platforms which integrate that. And as I see it, the solution has to be personalized precision healthcare where you enable the patient to become their greatest ally, and then the alignment between the practice of medicine, the business medicine, all that goes away. The patient is kind of directing their own care using our devices, using our technology, using our media, and using the smart services networks which we put together. I'm sure you guys know this, but they talk about burden of disease. In India, we don't really know because we have no one reporting standard. And in COVID, some of that actually got improved by the war rooms and some of it, but even then, I think the New York Times covered it, other people covered it, that we don't really know how many people died in India. Unless you know what people are succumbing to, how are you gonna kind of shift your machinery to attack it? We know that heart disease is the #1 killer worldwide, 17.5 million people a year, and in India, 17.5 lakhs, presumably. Because if you die in a nursing home, you die in other places, it may not be captured.
Yeah.
So I think what we need to do now is shift that. And this brings us to the technology part. We already have Aadhaar, we already have UPI, we already have digital measures of who's there. The Prime Minister recently talked about recovering birth certificates and recording them.
Right.
So now all of a sudden we're gonna have a real census. When that happens, we can add to that the technology part of it. And one project we worked on was raising awareness, entertaining and educating, and making people feel good about healthcare and taking it and moving the pendulum from acute care to prevention, early recognition, early treatment, where you make them in charge of it. They need to take some responsibility.
So, talking about media, etc., Ram has taken to social media quite a bit lately. One of the things I worry about when my son goes social media is like, whatever is there, you believe it, right? So we were talking about how it's important for experts to put, ideas out there, because otherwise you trust anyone, because there is nothing that says this person has been certified to give you advice, because you get 20,000 WhatsApp messages saying do this, do that, etc. So by doing something on Insta, you really changed your own behavior of uploading quick videos and really explaining to people in detail what they might be going through, etc. What has been that experience for you? As a cardiothoracic surgeon, you're really behind the patient, like an emergency room where nobody even sees you, to now everybody notices you out there. So do you feel you're more in service this way, or how is it personally for you, this shift?
Yeah, so it's an interesting question. We've always been in the limelight for other reasons because of my better half. But the issue is, in this context, it's interesting because this project was born in the pandemic when there was an equal amount of infodemic. Anyone and everyone was standing up on stage at the top of their lungs, shouting out theories, and honestly, you have to know when you don't know. What we tried to do was use evidence-based international standards, and we actually report all of those in our descriptions, but we did it in a way which was kind of, I wouldn't say dumbed down, but kind of at a Aam Aadmi level. So the idea was to get people to engage and think about this as their life and what we could do together. And it became vastly popular. I was stunned. We rose very, very fast in a period of 2 years, and we're still growing, and it's been a real pleasure, and I've collaborated with a lot of docs. I've asked a lot of difficult questions. I've become kind of like you know, the most amazing sutradhar who could bring out the voices. And, you know, I'm the first to admit I'm not the expert in everything. But this thing represented my life. I even had pieces for cooking. I had pieces for the family and going to college, and things which other parents were there for social well-being and mental well-being. I think all of these things for me helped me grow as an individual. The very interesting part, and we talked about this, that wherever I go, there's comments about it. I was at a party the other night from people in the actual industry, and they're like, we love what you're doing. You're so confident. We get a lot of information, and we're having fun with it. Yeah. And they also send me questions on the website and all of that. So my goal wasn't to make it about me. It was to make it about you, and you, and you, and you, and to kind of bring people together as a collective voice and start a grassroots movement.
We are kind of running out of time, so what I'll do is I'll ask you a few technologies. And what do you think? It's like a rapid fire kind of a thing. Do you think it's useful for India, and how? Okay?
Done.
I mean, we talked about AI and all that stuff, so I won't go there. Like, how about tests on a chip?
So I think they're very powerful. We need to bring the costs down, and we can use them potentially to disseminate care in places where they don't exist right now. Because there's only so many hospitals, so many labs, so many other things. And timely tests done in the appropriate patient after a thorough workup could save lives. So I do think that as we get better at containing costs and getting the chips done, for all of you, tests on a chip are basically little microchips loaded with different tests. You can do the assay and immediately get results. And it's something of what Sangeeta talked about where you could send it to home. Right now, they're somewhat expensive, but if we can get them down to the point of a COVID test, then it could be very, very interesting.
How about wearable devices?
So I'm a huge proponent. I've typically got 3 or 4, and they actually build into my infrastructure. So with what we're building, they act as a feedback loop. And the real question is, what do you do with the data? Temperatures, sensors, oximeters, all of that. But I think they will help us get a dashboard. Now the question is, will everyone be able to get them? And what my thinking is that depending on your social strata, in some cases you'll have your own, in other cases it'll be a shared instance. But the idea is we'll learn very, very quickly. On a separate note, Anurag was talking about CT scanners. We still don't know what to do with all that data, and there were a lot of surgeries done on incidentalomas, as we call them. And the idea is we get a lot of data from these devices. When we can predict heart attacks before they happen by heart rate variation, when we can predict when someone's getting sick by their temperature variations, when we can predict how your sleep patterns are affecting you, all of a sudden this becomes a very powerful tool. So I think wearable devices will definitely be there. They have to be, one caveat, they have to be innocuous. Yeah. So the lenses, the earplugs, they need to be something you would wear anyway. Like this Oura ring, also Ultrahuman has it, other people have it. It's very innocuous, and I would wear a wedding band anyway. This watch, not so much. You have to charge it every 2 days. It's a pain in the butt. And you do charge your phone, right? So, I mean, you end up doing this anyway. But I think it's a little obtrusive if you wear a watch. And nowadays, with a phone, you don't really need a watch, right? So it has to be something that's bio-design friendly.
Yeah. How about something like triage bots?
Oh,
like
I love
bots,
this.
actually.
I love this. So this goes back to the AI. So to counter, some sense, I don't know that we'll have enough doctors to send home, but I think if we can at least triage the basic symptoms, they have things which can listen to your voice and determine if you're sick. And they tested some of this in COVID. It was out of Israel. They have devices which can quickly do the healthcare assay, which Sangeeta talked about, and kind of determine what your risk factors are for disease. And then we can steer that. Now, look, in the olden days, your doctor did that, right? But I've already said there's not enough doctors. So if at least we can do the upper levels of triage and then figure it out, it gets very, very charming.
So the last one is, tell us a little bit about it. Nutrigenomics, sorry.
Yeah.
And what do you think about it?
So this is an interesting one.
Yeah.
If you can see inside someone and figure out what they can and can't eat and what suits them, This has been done on another level with cancers, right? They've looked at what DNA, what genetic code you have, and how it reacts to different types of chemotherapy. In the old days, we used to do it by testing it on the actual tumor. Now we can actually look at patient-related fish samples and other things. Let's go one step further and talk about it from the standpoint of assessing the genes and figuring out that this type of diet is better for one person and that type of diet is better for another. I'll give you a common use case scenario. 85% of non-whites are theoretically lactose intolerant, right? Because we don't need the milk in later days. The vitamin D comes from the sun. And so the idea is most people don't know it. But what if you could know ahead of time as an early test? The only problem with it is that your genetic code kind of varies depending on your age. And some of these genes are turned off later in life.
Yeah.
So I think it's important.
So the last question I have for you is, like in your talks also, you talk a lot about nutrition and other aspects and not just health and medicines and stuff. So what are one or two things you think are extremely important for us to pay attention to that we don't pay attention to today?
All right, so I'll go through, I did a talk on this actually, and there were 5 real things, right? To Vani, mindfulness and meditation are very important, and people don't do it enough. Taking a moment to just reflect is incredibly powerful. The second thing is sleep. Sleep is your protective cocoon, and when you neglect yourself, I will tell you that you're taking minutes off your life, because it's been shown that you can actually reduce your lifespan. The next thing is food, right? If you eat right, and the problem is we're going from an agrarian to an industrialized nation, and if you eat the same food you did when you were plowing fields and doing manual labor, and now you're in an IT center or a BPO or something like that, guess what's going to happen? We're going to become a diabetes and heart disease capital. Oh, that's right. What's happened, right? So the idea is if we can retrain people on eating what they need rather than what they want, right? And kind of assessing that need based on an individual basis, that would be powerful. The next thing is exercise. So they say that staying in shape is about 80% diet, 20% exercise. But I'll tell you as a sports guy, that 20% gives me huge joy. And the bottom line is, yes, you do spike your endorphins when you're working out and when you're playing competitive sports or any type of sports with friends. You will find a lot of happiness. And so the one point is that if you're going to work out, do it with friends because you'll be apt to do it again and again. And then the last thing is the happiness equation. Don't underestimate what happiness is and what it means to me. There was a very good study out of Harvard which looked at extrinsic and intrinsic motivation. And what they found was very interesting, that we're moving to a society because of social media, Instagram, all these things, where you want that Instagrammable moment. And what we're forgetting is that the intrinsic values which we started with are going the way of the dinosaur. Yeah. So for a moment, you have to look at yourself and say, what's important? And I would say to you, in reflection of where I am, family and friends are your most important assets, more so than anything you own, more so than anything you accomplish, because those experiences you generate together are lifelong, and they will save you. And there's various studies out of Italy, out of various other parts, which showed that if you're not lonely, loneliness is another interesting one, where it's been shown to decrease life expectancy, and it's like smoking 15 cigarettes a day. But the point is, if you're socially active, not lonely, you're apt to live longer. And so make sure you go out and meet people, you talk to them, understand their lives, and give back, rather than thinking about what am I going to get out of it. Because honestly, when you give, you get. And so those would be the 5 things I would think about.
And I just want to wrap up by saying it's so interesting when we talk. Before it used to be the number of beds and disease and all that stuff, and now it's the soft power, it's the happiness index, it's the mindfulness, etc. So both in leadership as well as in health, I think it's the soft power is really where it is. Thanks, Ram.
My pleasure. Thank you.
Thank you.
Thank you, everyone.